This tutorial will walk you through how to navigate the Outpace CBD data platform and use its key features. Here, you can enter your healthcare organization's data to access helpful reporting and benchmarking tools and to become eligible for national recognition tied to our outpatient quality improvement programs. Target BP, check change control cholesterol, and target type 2 diabetes. If it's your first time logging in, you'll need to choose a new password. The program's license and user agreement will appear next. You will click Agree to proceed. If you have access to multiple healthcare facilities, you'll be able to select the facility you want to view. Otherwise, you'll go straight to the community page. Here, you'll also be asked to set up password challenge questions to assist with future password resets. We highly recommend completing these. It makes it much easier to access your account if you forget your password or it expires. You can access the data platform by using a link from one of our program websites or by typing the platform URL into your browser, aha.infosaurierregistry.com/login. To gain access, you will need to register your organization. You can register at heart.org/registermyoutpatient.org. If your organization is already registered but you need a user account, contact us. After registering in 1 to 3 business days, you'll receive 2 emails from Infosario Outcome Support at quintiles.com with your username and temporary password. Be sure to check your spam and junk folders. For additional login assistance, use the Forgot Password or Need Help options. Once you log in, you'll land on the community page. This is your home base for the platform. From here, you can quickly access navigation tips in the upper right corner and view a snapshot of the data your organization has submitted to key programs, including Target BP, Check Change Control Cholesterol, and Target Type 2 Diabetes. The left-hand navigation bar makes it easy to move to the section you use most often. On the community page, you'll also find helpful tips to guide you through the platform, along with the logos for the programs your organization is registered for. If you ever need general guidance, the navigation's tip box in the upper right corner is a great place to start. It offers helpful information on how to move through the programs. If you have access to more than one facility, you can see which one you're currently viewing in the Currently Viewing section on the left, or by checking the facility name in the top right corner. You can easily switch between organizations by selecting Switch Current View. The Get Started panel highlights the most commonly used tools, including program forms, reports, and the library, so you can jump right in. Finally, the Get Started bar on the left side provides quick shortcuts to key areas. The community page, your home base. Program forms, where you can submit data for recognition. Form management, which supports additional benchmarking. Notifications, where platform messages appear. Operational reports, for visualizing performance and comparing results to peers. The library, with resources to support accurate data submission. And My Account, where you can update your password and account settings. Let's take a closer look at each feature, starting with Program Forms. Program Forms is where you enter your organization's data to be considered for national recognition. After selecting Program Forms, you'll see the programs your organization has access to, any prior or in-progress data submissions. A facility may have access to multiple Outpace CBD programs such as Target BP with forms already started or completed for previous measure years. If you don't see a program listed, make sure your organization is registered for that program at heart.org/registermyoutpatient.org. To begin a new submission, click Add New next to the appropriate program. For this demo, we'll be choosing Add New for Check Change Control Cholesterol. Type the year from which the data was collected, which should be a prior year. For example, data collected in 1 year is submitted for the following recognition cycle. If you want to enter data from earlier years to enhance your reports, simply type the desired year. But please note that we cannot provide official recognition retroactively for these years. Then hit Submit. Each program form varies by year and includes a unique set of questions, including demographic questions, clinical practice attestations, and quality performance measures. You will need to enter data on multiple tabs, so make sure to review each. You can save and exit to come back at any time. When all the data are entered, check the Data Entry Complete checkbox and click the Save and Exit button at the top of the page to finalize your submission. For detailed instructions, be sure to check out our platform demos detailing how to submit data for each program. Next up, form management. This houses your facility forms, which currently contains your site characteristics questionnaire. Click Facility Forms, then click Add New to start the questionnaire. Checking these boxes will make these filters available in your reports so you can see how your organization compares to other organizations of these types. These filters can be adjusted at any time. We highly recommend completing these to ensure organizations are classified appropriately and benchmarks are stable and accurate in reporting for all users. You only need to update the questionnaire once. Once you're done selecting, you can click Save and Exit. Next, let's look at notifications. Unread notifications display a red icon on the left navigation panel. Any updates or relevant messages are stored here. Next, we have operational reports. Each program includes reports that populate with visualizations of your organization's performance, benchmarks, trend over time, and evidence-based activities. These reports highlight the implementation of key quality improvement strategies. Target BP and Target Type 2 Diabetes also each have a report that focus on the achievement of evidence-based activities, allowing you to track your pillar attestations year over year. Please note, reports may take 1 to 2 hours to update after data submission. Let's walk through accessing measure reports. In this demo, I'll walk you through how to generate and use the Check Change Control Cholesterol report. You'll now be prompted to set your report parameters. All operational reports are automatically set to a reporting period of annually since they rely on annual aggregate data. First, select the reporting period. You can choose which years to include, starting from the year the program was introduced. In this example, we're selecting 2020 through 2024. Next, choose which benchmarks you'd like to include in the report. The available options reflect in the site characteristics you've already set up. My Healthcare Organization and all healthcare organizations are already selected by default, but you can add others as needed. For this example, we're also selecting federally qualified health centers and lookalikes. Once you've made your selection, click Apply Parameters. At the top of the screen, you'll see a bar chart displaying the performance rate for each selected benchmark. To focus on a specific benchmark or year, use the slider controls below the chart to move left or right. The bottom pane contains the benchmark table. You can click and drag the divider above the table to expand it for easier viewing and scroll up or down to see additional details. On the left side of the screen, you can adjust the reporting period and selected benchmarks in real time to instantly update the report. To download a copy of the report, click File in the upper left corner, then Export. You'll have several export options, but we'll select Microsoft Excel Export. Once the dialog box pops up, we'll select Export. This will export the data as an Excel spreadsheet with 4 sheets. You'll navigate to the Benchmark Bar tab to view the full bar chart, and to the Cross Table tab to view the full benchmark table. These steps will be the same for both the Target BP report and the Target Type 2 Diabetes report options under Operational Reports. Next, we'll walk through accessing the Target BP Evidence-Based Activities report. To get started, click on Operational Reports from the left-hand navigation bar. This report highlights how many evidence-based activities were attested to during the measurement year across 5 key areas or pillars: measure accurately, act rapidly, partner with patients, self-measured blood pressure, and equitable health outcomes. If you'd like more background on these questions, you can always visit the Target BP Evidence-Based Activities webpage. First, we'll select the Target BP Evidence-Based Activities report. You'll be prompted to set your report parameters. Like the other operational reports, the reporting period is automatically set to annually since this report uses annual aggregated data. First, select your reporting period. You can choose from 2020 forward, which is when the first Measure Accurately questions were introduced. For this example, we're selecting 2020 through 2024. Next, under Measures, choose which of the 5 pillars you want included in the report. For this walkthrough, we'll choose Measure Accurately, Self-Measured Blood Pressure, and Equitable Health Outcomes. Now, select the benchmarks you'd like to compare against. The options here are based on your site characteristics. By default, My Healthcare Organization and all healthcare organizations are already selected, and for this example, we'll keep those. Once everything looks good, click Apply Parameters in the upper right corner of the report window. At the top, you'll see a bar chart showing the number of activities completed within each selected pillar. This view shows your organization's results along with the average performance of the selected benchmarks. If you want a closer look at a specific year or benchmark, you can use the slider controls below the chart to move left or right. The bottom section displays a benchmark table. Here, you'll see the total number of activities achieved for each pillar along with the responses provided for each individual questions. To view additional details in the table, simply scroll or drag the navigation bar left or right. At any time, you can use the left panel to update your reporting period, selected measures, or benchmarks, and the report will refresh automatically. To download a copy of the report, click File in the upper left corner, then select Export. You'll have several export options, but we'll select Microsoft Excel Export. Once the dialog box pops up, we'll select Export. This will export the data as an Excel spreadsheet report with 4 sheets. You'll navigate to the Evidence-Based Activities bar tab to view the full bar chart, and to the Cross Table tab to see the full benchmark table. These steps will be the same for the Target Type 2 Diabetes report under Operational Reports. And that's a quick look at how to use the Target BP Evidence-Based Activities report. Let's take a look at the library. This feature brings together helpful resources for the registry and for all programs, even ones you're not currently participating in. Here, you'll find the helpful documents such as collection worksheets and FAQs to support data entry and answer questions about recognition requirements. In the library, you'll also find our evidence-based activities, resources, and examples toolkits. These resources are especially helpful for answering clinical practice attestations and for supporting the practical application of evidence-based activities, helping you understand how to effectively put them into practice. Clicking on most links will automatically download a PDF, like these helpful documents shown here. Other links, such as the latest QPP measure specifications, will open directly to an external web page. Last, we have My Account. Here, you can change your password and update your challenge questions. As a reminder, it is critical that you set up your password challenge questions so that you can access your account if you forget your password or it expires. If you need additional help, you can always scroll to the bottom of your window to find our support links. Click on Contact Support. Then click Contact Us. An American Heart Association staff member will respond. You're now ready to start submitting data and work towards recognition for all the hard work you're doing. Thank you for your continued commitment to improving the health of your patients.